Hey everyone, and welcome to The Explainer. So today, we're rethinking a topic that affects, well, a massive portion of the population. If you're a guy over 50, chances are you or someone you know is dealing with benign prostatic hyperplasia, BPH. It's literally the most common urologic disease in this age group. And honestly, the anxiety surrounding it, completely valid. It can make daily life incredibly frustrating. But don't worry, because the medical world has been evolving rapidly, and today we're breaking down a highly anticipated modern solution that might just change the whole game. Okay, let's dive right into this. What if you could fix an enlarged prostate without sacrificing your sexual function? I mean, this is the exact question keeping so many men up at night, quite literally. The deep-seated fear of traditional prostate surgery is the massive trade-off. You want to fix the urinary issues, of course, but at what cost to your overall quality of life? The fear of losing sexual function is a very real, very heavy burden. And you know what? It's entirely justified based on the historical standards of care. We actually have this pretty stark quote pulled straight from the medical records of a 62-year-old patient who was facing traditional procedures, like a whole EP or a TURP. He was flat out told by his doctor there was a 100% chance I would never ejaculate normally forwards again. His reaction? I didn't fancy the op. I mean, who would? Traditional options often mean hours under general anesthesia, a 5% risk of developing urethral strictures, and the virtually guaranteed loss of normal forward ejaculation. It's just a terrifying reality for a completely benign, non-cancerous condition. So what's actually causing all this misery in the first place? Well, imagine a walnut-shaped gland, the prostate, sitting right below the bladder and wrapping completely around the urethra. When it enlarges, which is exactly what BPH is, it presses inward. Think of it kind of like someone stepping heavily on a garden hose. This mechanical squeezing causes what doctors call lower urinary tract symptoms, or LUTS. We're talking incomplete emptying, straining, a really weak stream, and getting up multiple times a night. It is just exhausting. Section 1. The modern alternative. What is PAE? Enter Prostate Artery Embolisation, or PAE for short. Basically, this is a minimally invasive procedure that specifically targets and blocks the arterial blood supply feeding the prostate. Without that fresh blood, the abnormally enlarged tissue simply atrophies and shrinks. And here is a huge differentiator, guys. It's an outpatient procedure. It is not performed by a traditional urologic surgeon with a scalpel, but rather by an interventional radiologist using really advanced internal imaging. And this brilliantly illustrates how the blockage actually happens. A tiny microcatheter releases what we call microspheres into those specific capsular branches that feed the prostate. These little spheres physically jam up and block the blood supply. It's incredibly targeted, it's remarkably precise, and it stops the flow right where the problem is growing while leaving all the surrounding healthy anatomy totally alone. Now, what's really interesting here is the core biological concept. Think of it like starving a tumor. I mean, literally starving it. The medical terms are ischemia and necrosis, but essentially, if you cut off the fuel, the engine stops. The oversized adenomas, those extra lumps of tissue expanding inside the prostate, are completely deprived. They shrink away and die. As they soften and reduce in physical size, that intense pressure on your urethra finally lifts, and the garden hose is unkinked. Let's move to Section 2, inside the operating room, to see how the step-by-step PAE procedure builds. So here's the exact step-by-step breakdown. Step 1, you get local anesthesia, usually with a tiny access point right through your left wrist or sometimes the groin. You're entirely awake and comfortable. Step 2, the radiologist uses sophisticated digital x-rays on a large screen to guide a tiny tube, a microcatheter, all the way down to the prostatic arteries. Step 3, they inject those microscopic particles we just talked about to block those specific vessels. And Step 4, the catheter comes out, a small compression bandage goes on, and you are discharged the exact same day. If they use the wrist access, you can literally get up and walk immediately, and you're heading home within 2 to 4 hours. Taking a closer look at that third step, the delivery of those embolic agents. You know, these aren't big, clumsy plugs. They are microscopic, usually ranging from 100 to 500 micrometers. Think the size of a tiny grain of sand. Whether they're made of PVA or gel-like embospheres, they're specifically engineered to wedge perfectly into those tiny, tortuous arterial branches inside the prostate, creating a permanent roadblock. And get this, the entire procedure takes just about an hour and a half to 2 hours. To really drive home how non-invasive this truly is, let's look back at that 62-year-old patient from our source material. In his clinical testimonial, he noted that during the actual embolization, he literally laid back and, no joke, listened to music on his headphones. He described it as a very pleasant experience. I mean, that is a completely different world from the trauma of a traditional operating room. Section 3. The trade-offs. Pros versus cons of PAE. So, the crucial point here is understanding the balance. On the pro side, the benefits are phenomenal. No general anesthesia, an incredible 0% risk of retrograde ejaculation or sexual dysfunction, and rapid outpatient recovery. But on the flip side, we have to be realistic. There's about a 20% technical failure rate, meaning sometimes a patient's vascular anatomy is just too complex or twisted to navigate. You might also experience some minor temporary symptoms like burning or blood in the urine or semen. And importantly, unlike traditional surgery where the blockage is cut out instantly, PAE takes time. It can take up to 4 weeks for the tissue to fully shrink and for you to feel the final free-flowing results. But man, when those results do kick in, they are staggering. 54%. That is the massive prostate volume reduction our 62-year-old athletic patient saw after his PAE. Over 6 months, his prostate dropped from a massive 116 cubic centimeters down to just 53. That is more than half of the enlarged tissue completely gone, safely absorbed by the body. Absolutely wild. Now, just a quick heads up on the short-term recovery. You might experience a few hours of really intense, searing pain on the day of the procedure. Why? Because those prostatic nerves, suddenly deprived of their blood supply, are dying off. But the beautiful part of the mechanism is that once that deprived tissue necrotizes, those nerves essentially switch off like a light. The pain vanishes quickly. And from there, normal voiding begins to return, completely without relying on daily medications. Section 4. Next steps. Are you a candidate for PAE? All right, let's start with who actually cannot get this procedure. You're generally excluded if your prostate volume is under 40 cubic centimeters. There just isn't enough extra tissue there for the shrinkage to make a meaningful difference for your symptoms. Severe vascular disease or atherosclerosis is another major roadblock because hardened narrow arteries make it nearly impossible for the radiologist to safely navigate that catheter. And, of course, if there is a malignant tumor, meaning prostate cancer, PAE is contraindicated, and you'd need a completely different oncological treatment plan. Now, if you don't fall into any of those exclusion categories, your next step is assessing your symptoms using the International Prostate Symptom Score, or IPSS. It's a simple, standardized survey evaluating things like how often you have incomplete emptying, frequency, or a weak stream. You get a score. 0 to 7 means mildly symptomatic, 8 to 19 is moderate, and 20 to 35 means you are severely symptomatic. This score helps tentatively classify your condition and gives you some really hard data to take to your doctor. So, I'm going to leave you with this. What is your IPSS score, and are you ready to explore a real alternative to surgery? Your quality of life and your sexual function are absolutely worth taking action for. Take the questionnaire, talk to an interventional radiologist, and see if PAE is the right path for you. If you found this helpful, please like and subscribe if you liked this explainer, and for further explainers where we continue to break down complex medical topics into clear, actionable insights. Thanks for hanging out with us today, and stay proactive about your health.